Hello, my name's Jacqui Arnold. I've worked in social care for nearly 40 years, working with older people in a range of settings. I've worked directly with people as a carer and managed care homes before moving into training and development. I have extensive experience of providing training and consultancy and in relation to person-centred dementia care. I've sat on the board for Skills for Care and until last year held the role of dementia lead for a social care charity. As Head of Customer and Product Services for Milbotix, I provide domain expertise and insight into the product design. I'm part of a wider network within the care community and work specifically with forward-thinking and innovative social care organisations. Over the years, I've witnessed the devastating impact that unmet needs can have on people living with dementia. It's such needs that can lead to anxiety and agitation, especially if a person is unable to verbalise distress. I'm also aware of how busy care workers are and that a person's distress is missed because care workers are focusing on other people requiring care and support. This can lead to the escalation of distress and even greater negative impact on the person's well-being. On occasions, the missed opportunity of addressing distress and anxiety at an earlier stage can even result in the use of medication, which is rarely beneficial for the long-term well-being of the person. However, appropriate and ethical use of the Milbotix smart socks as an early warning system could alert staff much earlier to an increase in anxiety and distress, where they would then be able to employ support, comfort or distraction techniques to reduce the likelihood of ill-being being escalated. The smart socks developed by Milbotix appear to be the most suitable type of smart wearable available, as they are more tolerable and potentially less stigmatising than a wristband or other types of wearable. The smart socks are practical items of clothing that can be machine washed and don't require charging. They can be personalised in terms of colours or designs, and there's also been discussions to develop bed socks and tights in the future. Additionally, the data collected through the use of smart socks could help staff to identify any particular patterns of distress, and if a pattern emerges, use the detailed data to seek possible causes such as pain levels and identify solutions to reducing longer-term distress. The smart socks may also be a useful tool in reducing falls for some people, as there is often an increased fall risk when someone with dementia is moving around in an agitated and distressed state. Longer term, I also believe that smart socks have the potential to be used in hospitals when people are admitted as an inpatient and become further disorientated and agitated, and could alert the nursing team that assistance is required for that patient. Smart socks could have a far wider reach in terms of demographics, also being utilised with other people unable to verbalise distress, such as those who have a learning disability or developmental delay at any age, or people living with severe mental health conditions, and may even be of significant use within community settings. Obviously, there would be ethical considerations for the use of smart socks, but I strongly believe that used for the right reasons, in a right way, the smart socks offer something that is currently not on the market and would assist both the person themselves and a care team in order to prevent, minimise and better manage distress and anxiety when people are unable to adequately verbalise for themselves their emotional and psychological state. Thank you.